We have more tonight on the shortage of anesthesiologists in this province and the impact that's having at many hospitals. The problem first came to light in Cranbrook, where the East Kootenay Hospital was accused of hiring, in desperation, an anesthesiologist who is not yet fully licensed. And then we learned that a number of unlicensed anesthesiologists are at work around the province. Today, the province's health critic went to Cranbrook to get a first-hand look at the problem, while the health minister downplayed it.
This shortage isn't just within the smaller communities, as you're probably aware. It's also in
Cranbrook anesthesiologists met with the province's health critic today, pleading their case that without new recruits, their hospital is headed for trouble.
There's a shortage in British Columbia, and we've got to deal with it. And it's particularly acute here in Cranbrook, and that's resulted, in what people here are saying is a crisis, and I think it is.
The crisis so dire it's causing surgical delays. The hospital recently hired a new anesthesiologist, but the department had resigned over the decision, saying the recruit was unqualified.
Administration had assisted so far, but now they have completely taken over recruitment. We have no longer any say in who, what, when, how is brought into the workplace.
The concern isn't limited to Cranbrook. Since 2001, the province has recruited foreign doctors who aren't qualified to work here as anesthesiologists, but are given provisional licenses until they pass Canadian exams. Of the 17 who were brought in since 2008, 11 failed the tests, but 9 of those are still working. Cranbrook doctors say part of the problem is that locally trained anesthesiologists aren't given enough incentives to stay in town.
The other provinces are outbidding us, and consequently we have young graduates that leave the province, and there are lots of young graduates in other provinces who are looking for jobs, but they're not looking in BC.
BC's health minister responded to the complaints, accusing the anesthesiologists of playing politics.
Let's be clear about what's going on here. The anesthesiologists are in contract negotiations. And that's what this is all about. And I am profoundly disappointed that as a way of trying to advance their position in those negotiations, they would suggest that patients are being put at risk. It's not true.
The province says it is recruiting more anesthesiologists, but those who are already practicing in BC are qualified to do so.